China has identified the cause of the
mysterious new virus.
Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation.
The first US case has been detected.
There's confirmation the coronavirus has reached Australia.
China is urging its citizens not to travel abroad as it struggles to contain the virus.
We will be standing up Christmas Island as a quarantine area.
Foreign nationals coming from China are now banned from entering the country.
In late 2019, the world changed. A virus invisible to the eye stepped quietly across the borders and into everyday life. What began as a cluster of unexplained pneumonia cases became the defining public health crisis of our time.
So it's more important than ever that we roll out this vaccination program and get people protected.
Tonight, we ask a simple question. What really was COVID-19? Not just the headlines, not just the numbers, but the human story behind them. The science, the suffering, the economic shock, and the truths that arrived slowly and sometimes too late. COVID-19 is the disease caused by the virus SARS-CoV-2, a coronavirus related to viruses that cause cold, and also to more serious threats like SARS and MERS. It spreads primarily by respiratory droplets and under the right conditions through air in enclosed spaces. The virus could infect people with no symptoms. Some would get mild illness and recover at home. Others, especially older adults and people with certain health conditions, would fall dangerously ill, needing hospital care and oxygen. New variants changed the game. Some spread faster, others partially escaped immunity, and the world had to adapt with masks, distancing, testing, vaccination, and treatment. In early 2020, the virus crossed continents. Countries chose different paths. First, strict lockdowns, slower, targeted measures, or largely voluntary guidance.
Effective immediately, we will be closing outdoor playgrounds to the public and will not open city-owned spray parks on their regular seasonal schedule.
Those choices and how quickly they were made shaped outcomes. Take Italy. Severe outbreaks overwhelmed hospitals and led to very high death counts in 2020. Contrast that with countries that moved quickly to limit contacts, which often saw lower early mortality and were better positioned to protect health systems. In the United States,
if we don't slow the spread of this dangerous virus now, if we don't do this, the reality is that COVID-19 will overwhelm our hospitals, will overwhelm our healthcare systems.
surges came in waves with outbreaks, hospital strains, and regional variation. In India, a catastrophic surge in 2021 exposed weaknesses in oxygen supply and emergency care, and left deep scars on communities. Here at home, Kenya, schools closed.
We have suspended learning in all our education institutions with immediate effect.
City life slowed, and health services shifted priorities. Millions of learners were sent home, risking long-term setbacks in education.
And more than 3 million people have died from COVID-19 around the world. Many countries are still facing surges in deaths and cases.
Counting deaths during a pandemic is hard. Official tallies captured many fatalities, but they missed others, both direct COVID deaths and indirect deaths caused when health systems were overwhelmed or people could not get care. Analysis measuring excess mortality deaths above what's expected in normal years estimates that pandemic tolls is far higher than early official numbers. These estimates show how the tragedy was global and concentrated where systems were weakest. And for many survivors, the story did not end when they left hospital. Long COVID, lingering fatigue, breathless, cognitive fog became a chronic reality for millions, reshaping health and work lives. The pandemic also struck economies with enormous force. Borders closed, factories paused, tourism evaporated, and many lost livelihoods overnight. Government responded with emergency spending, but the damage was uneven. Advanced economies managed large physical responses. Lower-income countries faced tighter choices. The World Bank and IMF described the crisis as the deepest global recession in a century, with recovery likely to be uneven.
The organization called for the world's major central banks to ease monetary policy, adding that more aggressive measures are needed. She also explained that many emerging markets and low-income countries are likely to face significant challenges, while advanced countries are generally in better shape.
Poorer nations taking the longest to bounce back. Schools closed at a scale never seen before. UNESCO tracked closures that affected majority of the world's learners in 2020. Remote learning filled some gaps.
Personally, I do not like online classes because you don't get that in-class feel and you don't get that one-on-one connection with your teacher.
But not equally. Children without internet, devices, or safe study spaces fell further behind. The social cost extended beyond the classroom mental health strains rose.
It's just hard to get your focus on what you're actually supposed to be doing when the world's falling apart.
Social services were interrupted and inequalities widened. The pandemic did not hit everyone the same way. Scientists raced. Tests were developed, treatments improved, and in record time, multiple vaccines were authorized and rolled out. Vaccination changed the arc of pandemic, reducing severe illness and deaths, but access was uneven globally. Where vaccines rollouts were fast and broad, countries saw fewer hospitalizations and deaths. Where rollout was slow or supply was limited, vulnerable populations continued to suffer. The unequal distribution of these life-saving tools left a moral and practical change for the world. First, and accounting. Official death counts underrepresented the pandemic's full human cost. Excess mortality studies and WHO analysis later suggested the death toll was substantially higher than initially reported. Second, indirect damage. Ordinary health services were disrupted. Vaccinations, maternal care, and chronic disease management declined in some places. That indirect harm added to the total toll and will ripple for years. Third, fragility of supply chains. A virus can shut factories and choke critical global supplies from medicine to semiconductors, showing how interconnected and vulnerable systems are. Fourth origins remain incompletely resolved. International investigations into where SARS-CoV-2 first jumped to humans have made progress, but essential data gaps remain. The pandemic taught hard lessons. Invest in public health. Shore up supply chains. Ensure equitable access to diagnostics and vaccines. And support education continuity. It shows how fast societies can change and how quickly inequalities can widen if we don't act. COVID-19 will be studied for generations. Its lessons are written in hospital records, in classrooms attendance, in GDP reports, and in quiet stories of families who lost loved ones.
The chair means he's in heaven.
If we listen, we can build systems that are fairer, more resilient, and better prepared so the next time we do not learn the same lesson twice.